Alicia. I'm going to be your nurse today. We're going to be changing your central line dressing.
Okay, that sounds good.
All right. Before I would have come in the room, I would have checked the doctor's orders and verified that it was time to change the dressing. It's by facility policy. It's usually 3 days, or unless the dressing has become bloody or soiled or damp. Okay, I'm going to raise the bed up so it's more comfortable for me to work. If there was anything infusing through the line, I would stop it at this point and clamp the line as well. Are you able to wear a mask?
Yes, that's fine. It doesn't bother me.
Okay. If the patient wasn't able to wear a mask, I would just turn their head to the side so we don't contaminate the open insertion site. Okay, I'm going to uncover you for just a little bit. Okay, and I would check the insertion site through the old dressing to make sure there wasn't any redness or drainage, warmth, or any crepitus areas around it, and it looks good. We're going to get our sterile field ready. Away from me, and I'm going to make sure to touch only the 1-inch border. I'm going to get my mask. Okay, and I'm going to remove the old Tegaderm. And I'm going to make sure to put pressure on the hub while I'm taking it off so I don't accidentally pull it out from the insertion site. And I'm going to go from the bottom to the top. If I was having trouble removing the dressing, I would use an alcohol prep pad to help me get it unstuck. Okay. You always want to make sure that you have a trash can within reach. I'm going to remove my gloves, sanitize my hands, and then I'm going to put on my sterile gloves. Okay, this was just the sterile gloves out of my kit that don't really fit. I'm going to take the ChlorPret that was in the kit, and I'm going to push it until it pops. Then make sure that the applicator is wet. And I would take it and go over the insertion site first and the hub, and then I'm going to scrub back and forth in a circular motion away from the insertion site. And I'm going to do that for about 30 seconds. And we're going to wait for that to dry. We would not want to fan it or blow on it to make it dry faster because that would contaminate it. I'm using an alcohol prep pad to clean the lumens, and I'm going to go from the hub out and using a different prep pad each time. Making sure to hold on to the hub while you're doing this so you don't pull it out again. Okay, we're waiting for that to dry. If there was any skin breakdown or irritation, I would use the skin protectant prep pad before I put on the Tegaderm. And if there had been any dry blood around the insertion site, I would use the alcohol swab sticks to remove that blood before I'd done the chlor prep. Now we're going to put on our Tegaderm. Whenever we put this on, we want to make sure to center the hub. And then once we get it on there, get all the bubbles and the wrinkles out. And then we're going to peel it away and kind of press down the edges to make sure that we've got a good seal on it. And now I'm going to label this with my initials, the time, and today's date, so that they will know exactly when it needs to be changed again. And whenever I put this label on, I'm going to make sure to put it on the corner, so not to obstruct the view of the insertion site. Okay, we're going to cover it up. I'm going to remove the mask.
Thank you.
Let's sanitize. Let's get this back up. Lower you back down a little bit. Cover you back up. I'm going to remove all my supplies. Is there anything else I can get you right now?
No, I'm good right now. Thank you.
All right. Thank you. Have a good day.
Thank you.